Hi guys, so I thought I would come on and just share a little insight. So if you read my description for my YouTube, you will see that I have changed the context in the way that I'm going to be doing my channel. There's a few reasons for this. Firstly, I don't want to put added pressure on myself to have to keep posting consistently. Like, at first I started off posting every month or so, and it's gone from posting every month to every 2 months, then every 3 months, then every 4 months, and it's not been very consistent, and I owe it to you guys to be consistent. I apologize if you can see a red flashing light, by the way, in the door. That's coming from the electrical meter in the hallway. But yeah, I just feel that doing videos of updates and things like that, like, other than telling you what's happened at an appointment, or, you know, how my feed journey's going, or, you know, what I've done that day, or doing a lot of day in the lives, there's really not much for me to be updating you guys on. I have a lot of other things going on, and I'm still going to be sharing health journeys with you, with updates and new diagnoses and other things. But I think I'm also going to be posting potentially the odd singing video if I'm feeling up to it. My voice has not had a lot of practice singing for a while, but I'm hoping to get back into that. Our videos of the dog being funny, or which will probably come into a shorts or something. Maybe a video of how I make something, if I'm doing, for example, a cup of tea, or not a cup of tea, that's boring. Like, if I'm, for example, trying to bake something, make a cup of, like, some bread, or I don't know, I don't know what my content is going to be. I just know that it can't just be health stuff anymore. I originally started my channel off about, 12, 13 years ago, and it was primarily me singing, and I blocked some of those videos once I started this up, and I only left 3 videos on my channel of me singing available. However, for whatever bizarre reason, somebody decided to create a new URL using my name and my videos, and then took them and basically blocked them from my channel, despite the fact that my URL has never changed. Only my username has changed. In that last 12 years, for whatever reason, they've been able to steal my content and put it on their own channel, so I can no longer get that sorted out. I have contacted YouTube multiple times to have that person banned and removed for impersonating me and using my videos without consent. However, they don't seem to be doing anything about it. So yeah, not really much I can do about that. But yeah, I am trying so hard to do what I can when I can, but things have been pretty chaotic. This past year alone has just been like a blur to me. It's been so chaotic. The last couple of years in particular have been chaotic. I've had a hysterectomy, I've had a loop colostomy, I've had a buried bumper from my feeding tube. So in total I've had 3 surgeries, 2 major surgeries. I suppose a tube removal was classed as a major surgery because they had to debride necrotic tissue. So technically 3 major surgeries. I've had potentially 1, 2, 3, 4. I've had roughly around 7 feeding tube changes as well. And on top of that, I've had to recover from those 3 surgeries. I have had non-stop appointments to and from different hospitals. I'm now under a completely different hospital trust for my tube care because my local hospital neglected my buried bumpers so much that I had to go to a different hospital, and by the time I got there my bumper was literally ripping out of my stomach from the inside out. No word of a lie. I do have pictures, but I'm not going to gross people out with that. So yeah, I've had to deal with medical negligence, trauma, you name it, I've had to deal with it. So since my loop colostomy back in May, I have had other issues. So as you probably aware from my previous video, I was saying how I was being told I'd had a date for my loop colostomy surgery, and that's what they wanted to do. They did the loop. Unfortunately, the stoma nurses at the hospital I went to was not very happy because they didn't know I was coming, so they had to do all of their prep and all of the information all within 10 minutes of me before I went down to surgery, which was not ideal. So they were not happy. I think they put a complaint in about that. But I was basically slotted in where they could fit me. So I had my loop colostomy surgery a day before my daughter's birthday back in May, and I was in hospital for roughly 10 days. I was bedbound for a minimum of around 4 of those days. I didn't find out till my discharge that the reason I was bedbound was because I'd had I think it was a subclavian vein bleed during surgery, which they quickly sorted out for me, which was ideal. I didn't have to have a blood transfusion, luckily, but because of the nature of the bleed, it could have rebled, so of course I had to be kept on bed rest for a few days, which I was never told. So by the 3rd or 4th day, I was in so much pain with my EDS that I could barely move. When I did finally get out of bed and was able to move, I could barely walk. I could only sit out of bed for about half an hour before I had to get back into it. They had me strapped to the bed with compression cuffs rather than compression socks, and every time I was in bed they put my compression socks on, so I couldn't move. I couldn't physically turn over in bed because the socks would stick together, or rather the cuffs would stick together. So yeah, it was a lot. And then on top of that, I was being fed with the wrong feed because they didn't have my feed in, and because I was over an hour away from home, I couldn't take my own feed into the hospital to be given. So yeah, it was kind of traumatic. But after about 7 or 8 days, obviously 4 of them was in bed. By the 4th day I was begging them to let me out of bed. I gradually but surely managed to get out of bed by myself without the physios, which was very wrong of me because I was told that because I was classed as a fall risk, I was supposed to have people help me get in and out of bed. I would get myself in and out of bed, get myself to my table and my chair, try and have at least lunch out of bed, and then I would, because even though I'm tube fed, I still try and take things orally. So I would have some soup or something like that outside my bed, have a cup of tea, and then I would try and walk as best I could with my crutches to just around the bed mainly. I did have a physio come and try and help me walk to the door, and I almost fell, even though I had 2 crutches and 2 staff trying to help me get from my bed to the door because I was in a side room. And yeah, I struggled. I also couldn't go to the bathroom, so I was catheterized, so I had to carry a catheter around for 10 days basically. So yeah, it wasn't fun. Since then I begged and begged and begged to get out of hospital because I had a gastro appointment. Like I had my surgery on the Monday the 12th of May, and then I had a gastric appointment the following week on the Thursday that was at a different trust hospital, and I was eager to get to it because I'd been waiting so long for this appointment. So I was pushing and pushing and pushing to get out of the hospital for it. They managed to eventually get me down to urology to get my catheter removed, and then found that I was on the wrong size ISCs. ISC stands for intermittent self-catheterization. So they put me down a size on that, let me go home because I was begging to leave the hospital. As soon as I was able to do stairs, I was like, let's get out of here. But I'd also had trouble with my neck. So since December last year, I've been having problems with my left arm, to the point where it goes numb. I was having humongous amounts of pain in it. Did not know what was causing it. Obviously, when you're in an MRI machine, you are laid flat and still, and your head is boxed in, so your back is aligned. They didn't see any impingements, but the reason I was getting the pain and the numbness in my arm was because there was probably impingement on my spinal cord. I've been diagnosed with quite severe degenerative disc disease in my neck, which I'm waiting to see neurosurgery for. So that may potentially be another surgery I might have to have. My loop colostomy has been great. Everything's been working fine. It did take a while, took over 2 weeks to start working. Now it's quite active, it's doing fine. However, I have had trouble with the distal end of my loop. So the bottom part of my stoma that is no longer used for purposes for anything, because it's still attached to me and I still have my rectum and everything else. It still produces the mucus that you would need in order to help you have a bowel movement. However, mine gets stuck and it doesn't come out. So the whole point of having the distal end was to help that mucus be pushed up rather than be pulled down in the rectum and help it come out freely. However, I've had a lot of bleeding and a lot of issues since surgery, and I had to have a sigmoidoscopy recently. I had it in September. It was rushed through because of the symptoms I was having and I'm still having. And they noticed that I had diffuse proctitis near the rectal area and near the rectal stump, and then further up I have chronic colitis alongside infectious colitis with early onset of inflammatory bowel disease. So I need to have medications to try to alleviate those symptoms and hopefully help with the mucus production to expel on its own. If that doesn't work, then we have to try some distal pessaries or something to try and help with the mucus expulsion. If I'm still having issues with that, then the last possible resort would be to go back to surgery, turn my loop colostomy into an end colostomy, and have the lower end of my sigmoid colon and my rectum removed, and in theory give myself a Barbie butt, as it's known as, but it's also known as a proctocolectomy. That is obviously major surgery and I'm trying to avoid it as much as I can, so I'm happy to try anything in the world to try and help, even if it means steroidal treatment, just to try and help with this, because the pain is unbearable. It's in my lower back and pelvis. It's causing problems for my bladder. It's causing inflammation and swelling of my actual stoma, and also pain within my lower abdomen as well. And sometimes it's that unbearable I can barely walk. So yeah, it is needing treatment. I'm hoping that with the treatment things will improve, but I've got to wait for a consultation with my doctor, and that could take a while. So I could be in this situation for a lot longer, and I've been telling them there's been a problem for months, hence the reason I ended up with a very quick sigmoid in September. But again, it's took from May to September to get that, and then it took a further month or so to get my results, and now it's took me till now to actually speak to the stomal team and get them to push things along with my consultant. So it's probably going to be early next year before I even get to see my consultant to try any treatments to help with this. So I've been very busy. Since then as well, since I've had my loop colostomy, I've came out of hospital, I've had pretty much 4 appointments every single week since May. So I have been not so much being able to recover very well from my surgery. I've also been in and out of my house going to and from appointments, not just for myself but also for my son, who's type 1 diabetic and has other health issues. And then obviously on top of that you have your regular appointments like opticians and dentists and other things. So yeah, I have been consistently at appointments for months, and this is the first week since my operation that I have literally not had an appointment all week, which is technically a lie because I do have an appointment this week. I have one on Thursday, which is not really my appointment, it's more to get the car serviced. But yeah, I'm just having a hard time at the moment, and on top of that I have other things going on in the background that I can't and don't really want to talk about right now. And yeah, it's just been one thing after another for the past few years. It's just been chaotic. I was diagnosed with complex PTSD. I have been sent forward for assessment for ADHD and autism, so I'm on the waiting list for that, as is my son. So yeah, just still a lot more still to get through, I guess. I have another year or so before I can potentially get help for my CPTSD. But yeah, it's just been a lot, absolute lot. So yeah, I'm not very consistent. I post stories and do the odd post once in a blue moon on my Instagram. So if you follow me over there, then you'll probably see me be a little bit more consistent. But on YouTube, I'm not overly consistent. I have just posted a video of my dog when she first came to us, and we put her in my room for the first time. I have a wardrobe that has a mirror that goes right across the middle of it, and it's right at the bottom of my bed. So when the dog went up there, she would see her reflection in it, and she would just start barking because she thought it was another dog, and it's really funny. So I've posted that, and hopefully it will give you guys a bit of a giggle, because it made me laugh. You'll probably hear me laughing in the video actually. So I've posted that. I posted it initially on my TikTok, so yeah, hopefully you'll find this a funny video to watch. So yeah, but thank you so much for everyone who stuck around, everyone that's followed, everyone that has been patient with me. It means a lot. But like I said, from now on, my videos, there'll be no context to them. They will just basically be videos either updating you, telling you about family life, potentially how I've made something, if I've got the energy to sit in my kitchen and try and make something, just videos of me going out on an outing or whatever. Like, I will try and take you with me, things like that really. So there's no context to my channel anymore. It's basically just I'll post as and when I can, what I can, and hopefully you guys will enjoy it. So yeah, that's the concept of this video, and I hope that you don't mind and you still stick around and follow me. So yeah, please follow me into this new journey and chapter of YouTube, and I will speak to you again soon. And thank you again so far for sticking around. Bye.